We are going to go over what PPE you need when processing specimens. First, you want to make sure you have closed-toed and heeled shoes, a fully buttoned lab coat, making sure your sleeves are all the way down over your gloves, making sure you're having gloves on, and also behind your shield. This is a blue top. What you draw most commonly in this tube is your INR. There's also PTTs and many others. It's always good to check your test catalog when drawing for this type of tube type for any special tests or instructions. If you're drawing an INR, there's nothing needed for processing. All you need to do is send the whole blood tube. If you're drawing something like a PTT, you're going to need to centrifuge the specimen. So again, you need 2 tubes with the same amount of specimen. Pop in your centrifuge and set for 10. Next, we're taking out our blue top that we processed for a PTT. In this case, we need to spin down twice. So I've labeled aliquots, 2 aliquots that we're going to pipette into equally as much as possible. Making sure not to get the cells. Place the tops on the aliquots. And then we are going to place these aliquots in the centrifuge to spin one more time for 10 minutes. So now we are going to take out our spun down aliquots of our blue top. Now we need to take these and separate the plasma into 4 aliquots that are fully labeled. And should try and be as equal as possible. And try not to get the last bit, which could have possible cells in the bottom. And then you will return the caps to your tubes. And all of these will need to go into your Nordex provided freezer in a rack upright to be frozen. So SSTs are drawn most frequently for comprehensive metabolic panels, lipid panels, basic metabolics, and many, many more. The thing about SSTs is that they need to be spun. They can sit for up to 2 hours max, but need to sit and clot for at least 30 minutes. Sitting and clotting means upright in a rack, as so, for at least 30 minutes. Once they've clotted, you want to make sure that you have the same amount of specimen in each tube, or you can use a balance tube of just water. So you need to make sure you have a balance in your centrifuge from one hole to the next adjacent. So in this case, both the tubes were the same, so I can put them across from each other in the centrifuge. You'll shut and set this one for 10. If you have a different centrifuge, likely it will have a button. It's already preset for the time, so you would just close and set by pressing a button. Here, we're going to turn the dial to 10. So we're taking our SSTs out of the centrifuge. You can see that the serum is at the top and the cells are at the bottom. That's what we want. For certain tests, as you remember, most of them just need to be sent with their original tube as so. Some will need to be poured off into an aliquot that is labeled and then sent for testing. If you're drawing a microtainer, you also need to spin this specimen, as it's just like our big SST tubes, our serum tubes, just a smaller version. So you need to centrifuge. In order to do that, you can see that it's smaller. It's not going to fit directly into our centrifuge for this size centrifuge. So if you're using this centrifuge, the Hamilton Bell, you need to use a conical, which comes with a cap. You don't need the cap, but you do need to put that in and put a piece of paper tape around the top to secure it to make sure it doesn't fly off in the centrifuge. You also need your balance tube with the same amount to put in the centrifuge as well. So you will pop in just like your other tubes, place the lid down and set for 10 minutes. This is your red top, which is also serum like the SST. It does not have the gel barrier. So this tube also needs to be spun within 2 hours of sitting or a minimum of 30 minutes sitting and clotting like the last. This one we put the comment label on because we know the actual serum specimen needs to go into a pour-off. So in this case, we have one tube. We need to make sure we have a balance of specimen before we centrifuge. So again, you're going to put it in the centrifuge like so, close it, and spin for 10. So now we are taking out our red top from the centrifuge. This does not have a gel barrier, but you can see that the cells are at the bottom and the serum is at the top. We need to, as soon as possible, pipette off the serum into an aliquot that's fully labeled with a white cap. To do that, you're going to pop the top of the tube behind your shield, making sure you're always behind your shield. Squeeze the pipette, place in the tube, making sure not to get any cells into the pipette. Once you've got your serum, you're going to place into your aliquot, toss away, put your cap on, make sure your cap for your serum is nice and tight, and then it's ready for setting. Some tests do require freezing for red top, so again, it's always good to check your test catalog. So this tube is a navy blue serum tube. So we have two different options for navy blue, which are both metal free. You have the serum option and you have a plasma option. Plasma has a purple stripe down the side. The serum has a red. So in this one, we know we're going to have to centrifuge and pour off, just like the others. In this case, we put the comment label again on the tube, and we're going to use the regular barcoded label on the aliquot once it's spun. So we need to also balance, like we've done before, in the centrifuge, close it, and set for 10. Next, we are going to take out our navy blue serum tube, which is the one with the red stripe. So again, it's a metal-free tube, so you need to use a metal-free aliquot. And again, you cannot use a pipette, so you need to pour the serum into the tube, making sure not to get any cells into the tube. So do it very, very slowly. Once you've poured it off, secure your aliquot. This is a PST, also known as a plasma separator tube. It has gel, just like our SST, but in this case, we're gonna get plasma instead of serum. So in this case, this tube does not need to clot. It does need to be centrifuged. So you can pop it right into the centrifuge if you're spinning something else, or do it within 2 hours. So again, you need to make sure you have about the same amount of specimen. Pop into your centrifuge, close the lid, and set for 10 minutes. So now we're going to take our PST out of our centrifuge. The PST, again, has the cells on the bottom, the plasma on the top. This is usually sent just as is. This tube is commonly drawn for your quantiferin gold TB tests. It's very important that this tube is drawn full, and then after it's drawn, it needs to sit in the rack for at least 15 minutes, up to 3 hours. It's extremely important, and it's a crucial step that it sits at room temperature. After it's done sitting, you are going to mark the time on your yellow sheet of when you are going to put it into the refrigerator. Place your slip in the bag with the specimen and place it in the refrigerator until it's ready to go with the courier. This is a lavender top tube. This is most commonly drawn for CBCs or hemograms. also for homocysteines and many other tests. It's really good to check your Nordex test catalog prior to drawing these because of certain tests may need certain processing instructions, including spinning down, pouring off and freezing, drawing in a chilled lavender top, which you could store in either a chilled tube chiller or in a refrigerator. So this one is for a CBC, so there is no processing except to send as is. This is another lavender top tube. In this case, we are doing a homocysteine processing. So we know that we have to spin and pour off, so we needed to use the comment label on the actual mother tube. The test label will go on your aliquot after you've spun and poured off. So in this case, we're going to spin. So we need a balance tube with the same amount of specimen in each. So again, you're going to put in your centrifuge, close the lid, and set for 10 minutes. Next, we are going to take out our lavender top tube that we placed in the centrifuge. This we have processed for a homocysteine, so we needed to spin down and pipette off. I have my fully labeled aliquot here, ready to go. Use your pipette to pipette off, making sure not to get the cells. Secure the top, and in this case it needs to be sent refrigerated. This is a navy blue plasma tube, as we were showing, has a purple label on the side. These tubes can be either whole blood or need to be separated. So in this case, this test is a magnesium red blood cells, and we have to separate, so they need to be spun and then poured off. So again, we need a balance tube with the same amount of blood and place in the centrifuge. You're going to close the centrifuge and set it for 10 minutes. Now we are processing our navy blue EDTA tube. As you can see, the cells are at the bottom, plasma at the top. For these tubes, both the serum and plasma version, you need to make sure you're using a metal-free aliquot when pouring off. So in this case, I have my aliquot metal-free labeled, ready to go. In this case, you cannot pipette, you cannot use that. You have to pour off manually. So again, behind your shield, you're gonna make sure you pop off your tube. I like to make sure I can see the plasma and the aliquot to make sure I'm pouring correctly. You really wanna be careful here not to get any cells into the aliquot. So you have to do very slow. Get as much as in there as you can without the cells. Secure your aliquot. In this case, we need to send both the mother tube of cells with the plasma. So I like to take a piece of paper tape to secure your navy blue top to make sure that cap doesn't fall off because we've already broken the seal. You're going to take both the tubes and use a small elastic band to put them together to place in the rack to make sure they always stay together. Now we're going to go over how to rack your specimens. Each patient should take up one column of your rack, and you're going to start from left to right with your specimens. You're going to take your requisitions that you had and make sure that they are in order of your patients. Fold them once and place them under the rack and place them in a large plastic bag for the courier. If you only have one patient sample, you're able to use one small bag, and place your samples in, fold your requisition one time, and place in the pocket on the back side of your bag.